Welcome to my blog Sumud. This week's topic is migration and disability, barriers to healthcare access in Lebanon. Lebanon is the largest host of refugees per capita in the world. It is estimated that Lebanon hosts about 480,000 Palestinian refugees, 1.5 million Syrian refugees, and about 15,000 refugees of other nationalities. Refugees in Lebanon have a high incidence of people with disabilities. While about 10 to 15% of the Lebanese population has physical, intellectual, or mental disabilities, refugee populations have slightly higher percentages. For example, between 10 to 22.8% of refugees from Syria are estimated to have one or more disability. Refugees and persons with disabilities are considered two of the most marginalized groups in healthcare worldwide, including in Lebanon. Healthcare and rehabilitation services are often inaccessible for persons with disabilities in Lebanon. Moreover, the healthcare system in Lebanon is fragmented, whereby refugees of different nationalities access different services through different healthcare providers. These factors exponentially increase refugees' persons with disabilities' difficulty in accessing healthcare services. Barriers to healthcare access. The barriers discussed below are based on a participatory research study conducted by the Arab NGO Network of Development in collaboration with the Issam Faris Institute. The study included a mixed method, quantitative and qualitative, approach with 5 informal groups of refugee persons with disability. The majority of participants were Syrian refugees, followed by Lebanese and Palestinian refugees from Syria, all based in the Bekaa and North Lebanon governorates. Firstly, affordability. The study showed that financial difficulty is the most common barrier for accessing healthcare for refugee persons with disabilities, indicated as the most common barrier among respondents. Unemployment rates and consequently poverty rates are high among refugees and persons with disabilities in Lebanon. More than 80% of Syrian refugees and Palestinian refugees from Syria who participated in the study reported being unemployed. In Lebanon, there are no anti-discrimination laws or policies to include persons with disabilities in work institutions. Vocational trainings for persons with disabilities, which match with labor market needs, are not available either. Together, this results in an exclusion of persons with disabilities from the labor market and increases their poverty levels. Moreover, 57% of Syrians and 80% of Palestinian refugees from Syria in the study chose a lack of free healthcare service provision as their second most common barrier to accessing healthcare services. The Ministry of Public Health's primary healthcare centers provide some acute medications free of charge for Syrian refugees and vulnerable Lebanese. However, permanent medications for chronic cases are not provided free of charge and require out-of-pocket payments. Availability and acceptability. About 56% of respondents stated that there is limited availability of specialized rehabilitation services in Lebanon. In addition, protection issues act as a key barrier deterring refugees from accessing the available services. Refugee persons with disabilities often feel unaccepted as a result. Major protection issues reported include exclusion from services, financial exploitation, and psychological violence. Albeit less common, refugee persons with disabilities also reported physical and sexual violence, as well as gender discrimination. About 60% of certain persons with disabilities who participated in the study reported their lack of trust in the system as a barrier to accessing healthcare services. Reachability. Physical and information reachability are two commonly reported barriers to accessing healthcare services among respondents. Many health centers were reported as inaccessible by persons with disabilities due to structural barriers such as lack of ramps and elevators, in addition to a lack of staff trained on dealing with persons with disabilities. The same study showed that there is a lack of awareness among persons with disabilities about the services available to them. This shows that adequate information about available services is not being provided to them. Most respondents reported that information that they receive about services is through word of mouth within their community and not from official groups, healthcare centers, or organizations. Key recommendations. Inclusive employment programs for persons with disabilities, refugees in Lebanon must be considered an essential action. Providing groups with equal opportunities in the labor market will alleviate many of the social and health problems that these populations face in Lebanon. Need-based social protection programs must be implemented in an equitable manner and include vulnerable groups of all nationalities in the country. On a health system level, a scheme for supporting vulnerable residents in Lebanon is required. Rehabilitation services and chronic medications must be provided free of charge. Increased donor support and shifts to sustainable financing methods at the Ministry of Public Health and refugee UN agency levels will help the healthcare system financially support this expansion. There is a critical need for increasing the availability of specialized services. Moreover, trainings for healthcare staff on the appropriate way to deal with persons with disabilities are essential. Protection laws across all sectors, including healthcare, are desperately required, and adherence measures must be put in place and complied with. This would ensure protection for persons with disabilities and eventually increase their trust in accessing services. A code needs to be put in place to require structurally accessible means for persons with disabilities to physically access healthcare centers, such as ramps and elevators. Finally, the Ministry of Public Health, healthcare providers, and organizations, in collaboration with community leaders and communities, should launch an awareness campaign for persons with disabilities about the available healthcare services and their rights to care.